The heart is a powerful organ about the size of your fist, nestled in your chest. Despite its small size, it plays a huge role in keeping you alive every single second of the day. Protected by your ribcage, the heart sits slightly to the left, working quietly but tirelessly. It works non-stop, pumping blood throughout your body. In fact, your heart beats around 100,000 times every day, moving about 2,000 gallons of blood. This constant motion is what keeps you going, whether you're awake, asleep, resting, or running. This blood carries oxygen and nutrients to every cell, keeping you alive and energized. Without this steady supply, your organs and tissues wouldn't be able to function. The heart also helps remove waste products like carbon dioxide from your body, making sure everything runs smoothly. Think of your heart as a delivery truck, constantly on the move, ensuring every part of your body receives its essential supplies. It never takes a break, even when you're sleeping, and it adapts to your needs, beating faster when you exercise and slowing down when you rest. This continuous pumping action is fueled by electrical signals that make the heart muscle contract and relax in a rhythmic beat. These signals travel through the heart in a precise pattern, keeping everything in perfect sync. When you feel your pulse, you are feeling these contractions. Each beat is a sign that your heart is working as it should, sending life-giving blood to every corner of your body. It's a testament to the heart's incredible strength and endurance. Whether you're climbing stairs, laughing with friends, or simply breathing, your heart is always there, supporting you. Just like any other part of your body, your heart needs care and attention to function properly. Eating healthy foods, staying active, and managing stress all help keep your heart strong. Understanding how your heart works and what can harm it is the first step towards a long and healthy life. By learning more about this mighty pump, you can make choices that protect your heart and help it keep beating strong for years to come. Heart disease is a broad term that encompasses a range of conditions affecting the heart's structure and function. It's like saying a car has engine trouble. It tells you something is wrong, but not the specific problem. Some heart conditions affect the heart's valves, causing leaks or blockages that disrupt blood flow. Others impact the heart muscle itself, making it weak or stiff. And then there are conditions that affect the blood vessels supplying the heart, narrowing them and restricting blood flow. Understanding the different types of heart disease is crucial in recognizing the warning signs and seeking timely treatment. Imagine trying to water your garden with a hose that has a kink in it. The water struggles to flow through, right? That's similar to what happens in your body with high blood pressure, also known as hypertension. High blood pressure occurs when the force of blood pushing against your artery walls is consistently too high. Over time, this constant pressure can damage your arteries, making them less flexible and more prone to blockages. The scary part is, high blood pressure often has no symptoms, earning it the nickname the silent killer. It silently damages your heart and blood vessels, increasing your risk of heart attack, stroke, and other serious health problems. Think of your heart as a house with a complex plumbing system. The arteries are like the pipes, carrying blood to different rooms or parts of the heart. A heart attack occurs when one of these pipes gets clogged, cutting off the blood supply to a section of the heart muscle. The most common culprit behind this blockage is a buildup of plaque, a sticky substance made of fat, cholesterol, and other materials. When this plaque ruptures, it forms a blood clot that can completely obstruct the artery, leading to a heart attack. Without a steady supply of oxygen-rich blood, the affected part of the heart muscle begins to die. This is why it's crucial to seek immediate medical attention if you suspect a heart attack. Time lost is heart muscle lost. If a heart attack is a plumbing problem in the heart, then, well, a stroke is like a traffic jam in the brain. It happens when the blood supply to a part of the brain is interrupted, either by a blockage, what we call an ischemic stroke, or a rupture, which is known as a hemorrhagic stroke in a blood vessel. Just like the heart, the brain really depends on a constant flow of oxygen-rich blood to keep working properly. When that flow gets disrupted, brain cells begin to die, and this can lead to a range of disabilities depending on which area of the brain is affected. These disabilities might include paralysis, speech difficulties, memory loss, and even vision problems. While some risk factors for heart disease, such as family history and age, are beyond our control, understanding them is the first step in protecting your heart. These factors can help your doctor assess your overall risk and guide you toward the right preventive measures. But it's important to remember that genetics are only part of the story. Many other risk factors are shaped by the choices we make every day. The food we eat, whether we reach for a colorful salad or a greasy burger, plays a powerful role in our heart health. The amount we move our bodies, from regular exercise to simply taking the stairs instead of the elevator, can make a significant difference. Even the air we breathe, whether it's clean and fresh or polluted, can either nourish or harm our hearts, affecting our cardiovascular system over time. An unhealthy diet high in saturated and trans fats, cholesterol and salt can silently damage your arteries, setting the stage for heart disease long before symptoms appear. These foods contribute to the buildup of plaque inside your arteries, narrowing them and making it harder for blood to flow freely. Lack of physical activity weakens your heart muscle, making it less efficient at pumping blood and more vulnerable to disease. Inactivity also increases your risk of obesity, high blood pressure, and other conditions that put extra strain on your heart. Diabetes, often linked to poor diet and inactivity, is another major contributor to heart disease, as high blood sugar can damage blood vessels over time. Smoking damages your blood vessels, raises your blood pressure, and accelerates the buildup of dangerous plaque, making it one of the most preventable causes of heart disease. It also reduces the amount of oxygen your blood can carry, forcing your heart to work harder with every beat. Stress, while a normal part of life, can trigger unhealthy habits like overeating or smoking, and if left unmanaged, it can raise your blood pressure and heart rate. Learning to manage stress through relaxation techniques, mindfulness, or talking to a professional can help protect your heart in the long run. The good news is, by making healthier choices, like eating nutritious foods, staying active and managing stress, you can take control of your heart health. With every positive step, you can significantly reduce your risk of developing heart disease and enjoy a longer, healthier life. Preventing heart disease isn't about making drastic changes overnight or following a strict, joyless routine. Instead, it's a journey of small, meaningful steps that gradually transform your daily life. The power of prevention lies in the choices you make every day, and even the smallest positive change can have a big impact over time. It's about adopting small, sustainable habits that add up to a heart-healthy lifestyle. These habits don't have to be overwhelming or complicated. Start with simple actions like choosing to walk instead of drive for short trips, or adding an extra serving of vegetables to your dinner plate. Think of it as making deposits into your heart health bank account. Every positive choice you make, no matter how small, contributes to a healthier future. Over time, these deposits add up, building a strong foundation for lifelong wellness. Start by fueling your body with nutrient-rich foods. A balanced diet is one of the most powerful tools you have to protect your heart. Choose a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats like those found in nuts, seeds, and olive oil. Try to limit processed foods, sugary drinks, and unhealthy fats, such as those found in fried foods and packaged snacks. Planning your meals ahead of time can help you make healthier choices and avoid last-minute temptations. Make physical activity a part of your daily routine. Regular movement helps keep your heart strong and your body energized. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Find activities you enjoy, whether it's brisk walking, dancing, swimming, or cycling. Even short bursts of movement throughout the day can make a difference, so take the stairs, stretch at your desk, or go for a quick walk during lunch. If you smoke, quitting is the single best thing you can do for your heart health. Smoking damages your blood vessels and increases your risk of heart disease, but the benefits of quitting begin almost immediately. There are resources available to help you quit, including counseling, support groups, and medications. Don't hesitate to seek support from healthcare professionals, friends, or family members who want to see you succeed. Manage stress through relaxation techniques like deep breathing, progressive muscle relaxation, or simply taking a few moments each day to pause and reflect. Meditation, yoga, and mindfulness practices can help calm your mind and reduce the harmful effects of stress on your heart. Make time for activities you enjoy and connect with loved ones for social support. Strong relationships and a sense of community can boost your mood and help you stay motivated on your heart health journey. Remember, every step you take towards a healthier lifestyle is a step towards a stronger, healthier heart. Prevention is a lifelong commitment, but with each positive choice, you're investing in a brighter, healthier future for yourself and those you love. While prevention is key, it's equally important to recognize the warning signs of heart trouble and seek medical attention immediately. Don't ignore your body's signals, hoping they'll just go away. Chest pain is a common symptom of a heart attack, but it's not always the classic crushing pain you see in movies. It can feel like pressure, squeezing, fullness, or a burning sensation in your chest. Other warning signs include shortness of breath, nausea, lightheadedness, cold sweats, and pain or discomfort in your arms, back, neck, jaw, or stomach. If you experience any of these symptoms, especially if they are severe or persistent, call 911 or your local emergency number right away. Don't wait to see if the symptoms pass. Every minute counts when it comes to treating a heart attack or stroke. Your heart is a remarkable organ working tirelessly to keep you alive. By understanding how your heart works, the factors that can harm it, and the steps you can take to protect it, you're empowered to make choices that support a long and healthy life. It's never too early or too late to start taking care of your heart. Every healthy choice you make, no matter how small, is a step in the right direction. Remember, a healthy heart is at the core of a healthy life. By prioritizing your heart health, you're not just reducing your risk of disease, you're investing in a future filled with vitality, joy, and countless moments to cherish.